Welcome to our exploration of pain modulation in chronic musculoskeletal disorders, focusing on the role of botulinum toxin or BONT. Chronic pain from musculoskeletal conditions can be challenging to manage, especially when first-line treatments fail. In recent years, BONT has emerged as a promising option, offering relief for patients with persistent pain. This video will guide you through the mechanisms, clinical applications, and research findings surrounding BONT in various musculoskeletal disorders. Let's begin by understanding what BONT is and how it works in the body. Botulinum neurotoxin, commonly known as BONT, is produced by the bacterium Clostridium botulinum. It's best known for its ability to block the release of acetylcholine, a neurotransmitter essential for muscle contraction at the neuromuscular junction. This action leads to temporary muscle relaxation. However, BONT also interferes with other substances involved in pain perception, such as substance P, contributing to its analgesic effect. The toxin's unique properties have made it a valuable tool in both medical and cosmetic fields. There are 7 known serotypes of botulinum toxin, labeled A through G in clinical practice. Serotypes A and B are most commonly used. BONT-A is available in several formulations, including Botox, Dysport, and Xeomin, while BONT-B is marketed as Myoblock or Neuroblock. Each formulation has specific dosing and administration guidelines. Understanding these differences is important for clinicians to ensure safe and effective treatment tailored to each patient's need. BONT acts by targeting snare proteins, which are crucial for the release of neurotransmitters from nerve endings. By cleaving these proteins, BONT inhibits the release of acetylcholine and substance P, leading to muscle relaxation and pain relief. The reduction in acetylcholine causes temporary muscle weakness, while the decrease in substance P is linked to its analgesic effects. This dual action makes BONT particularly useful in conditions involving both muscle overactivity and chronic pain. Additionally, BONT has been used to treat focal dystonia, spasticity, and various muscle disorders. Its applications have expanded to include chronic pain syndromes, especially when conventional therapies are ineffective. BONT is now considered for conditions such as plantar fasciitis, knee osteoarthritis, painful joint arthroplasty, muscular contractures, neuropathic pain, and myofascial pain syndrome. The decision to use BONT is often based on the severity and refractoriness of the condition. Comprehensive review of the literature reveals that BONT has been studied in a variety of musculoskeletal pain conditions. Researchers have conducted randomized controlled trials, case series, and observational studies to evaluate its efficacy. The evidence is promising, but results are sometimes heterogeneous, highlighting the need for standardized protocols. The most common conditions studied include plantar fasciitis, knee osteoarthritis, lateral epicondylitis, neuropathic pain, and myofascial pain syndrome. Plantar fasciitis is a common cause of chronic heel pain, often resistant to standard treatments. Surgery is considered a last resort, so alternative therapies are highly sought after. BONT has gained attention for its potential to relieve pain and improve function in patients with refractory plantar fasciitis. Studies have explored various injection techniques, including intrafacial and intramuscular approaches, each with its own advantages. Clinical studies have shown that BONT injections, whether into the fascia or small plantar muscles, can significantly reduce pain and improve walking ability. Techniques vary, but common methods include the Babcock technique and ultrasound-guided injections. Both short-term and long-term improvements have been reported, with some studies noting decreased plantar fascia thickness on ultrasound. Importantly, adverse reactions are rare, making BONT a safe option for many patients. The osteoarthritis is a degenerative joint disease with no known cure. The main goals of treatment are to relieve pain, reduce inflammation, and maintain function. When standard therapies like corticosteroids fail, BONT may be considered. Its analgesic and anti-inflammatory effects are attributed to the inhibition of neurotransmitters such as substance P and CGRP. Research has focused on intra-articular injections for pain relief and functional improvement. Studies have demonstrated that intra-articular BONT injections can provide significant pain relief and improve joint function in patients with moderate to severe knee osteoarthritis. The effects may last from a few weeks to several months, and repeated injections can act as boosters. While some studies show mixed results, the overall safety profile is favorable, with few reported side effects. BONT may be especially useful when other treatments are not effective or contraindicated. Persistent pain after knee replacement surgery or arthroplasty can be difficult to manage. When infection and mechanical issues are ruled out, treatment options are limited. BONT has been shown to reduce pain and improve function in these challenging cases, especially when administered intra-articularly. Some patients may require repeated injections to maintain relief, but the safety profile remains strong, making BONT a valuable tool for refractory cases. Bone contractures, especially after surgery, can limit mobility and quality of life. BONT injections in specific muscles, such as the hamstrings or calf muscles, can reduce tightness and facilitate rehabilitation. This approach is particularly useful when physical therapy alone is insufficient. Studies have shown improvements in range of motion and function, supporting the use of BONT as part of a comprehensive rehabilitation plan. Similar to the knee, hip contractures can develop after joint replacement or due to chronic conditions. Targeted BONT injections into muscles like the adductors, tensor fasciae lata, and rectus femoris have been shown to increase hip mobility and improve gait. When combined with rehabilitation, patients often experience significant functional gains, making BONT a valuable adjunct in managing complex contractures. Chronic lateral epicondylitis, also known as tennis elbow, is a degenerative tendon disorder that can cause persistent pain. BONT injections, either intramuscular or intratendinous, have been shown to reduce pain and improve grip strength. The analgesic effect may last up to 16 weeks, and targeting the correct muscle with low doses can minimize side effects like temporary muscle weakness. ONT offers an alternative to corticosteroids, especially for recurrent cases. Neuropathic pain, including conditions like postherpetic neuralgia, diabetic neuropathy, and trigeminal neuralgia, is notoriously difficult to treat. ONT has shown promise in reducing pain intensity and attack frequency in these conditions. Administration techniques vary, including intradermal, subcutaneous, and paraneural injections. The safety profile is generally favorable, with mild and transient side effects. Trigeminal neuralgia is a severe facial pain condition often treated with medications like carbamazepine. When these fail, ONT injections can provide significant relief. Studies show that both low and high doses are effective, with higher doses offering longer-lasting benefits. Side effects are usually mild, such as temporary facial asymmetry, and resolve on their own. ONT may be considered as a second-line or even first-line therapy in some cases. Postherpetic neuralgia, a complication of shingles, can cause persistent and debilitating pain. ONT injections administered subcutaneously in the affected area have been shown to provide significant pain relief that can last for several months. This makes ONT a valuable option for patients who do not respond to topical or oral medications. The procedure is generally well tolerated, with few adverse effects reported. Peripheral diabetic neuropathy is a common complication of diabetes, often resulting in chronic pain that is difficult to manage. ONT injections into the dorsal foot, using a grid pattern, have been shown to reduce pain for up to 3 months. This approach is particularly useful for patients who cannot tolerate standard medications or who have localized pain. ONT may serve as an adjunct to other therapies in managing diabetic neuropathy. Complex regional pain syndrome, CRPS, is a challenging condition characterized by severe persistent pain. ONT has been used in various ways, including intradermal, intraarticular, and sympathetic block injections. While results are mixed, some patients experience significant pain relief and improved function. The addition of ONT to sympathetic blocks may enhance and prolong the analgesic effect, especially in cases resistant to other treatment. Carpal tunnel syndrome, caused by compression of the median nerve, leads to pain and numbness in the hand. ONT injections, either directly into the carpal tunnel or into the flexor muscles, can reduce pressure on the nerve and improve symptoms. Studies have shown improvements in pain, sensation, and nerve conduction, making ONT a potential option for patients with mild to moderate carpal tunnel syndrome. Orton neuroma is a painful condition affecting the nerves of the foot, often unresponsive to conservative treatments. ONT injections into the area of the neuroma have provided pain relief and improved foot function in a majority of patients. The effects may last several months, and repeat injections can be considered for persistent symptoms. ONT offers a non-surgical alternative for refractory cases. Myofascial pain syndrome involves chronic muscle pain and trigger points. ONT injections into trigger points can provide significant pain relief, especially when combined with physiotherapy. While some studies show similar effects to local anesthetics, ONT may offer longer-lasting benefits for patients who do not respond to other treatments. The choice of muscle and dose is important for maximizing results. Effectiveness of ONT depends on the injection technique, dose, and target tissue. Techniques include palpatory guidance, ultrasound guidance, and electromyographic validation. Accurate localization ensures that the toxin reaches the intended muscle or tissue, maximizing benefits and minimizing side effects. Clinicians must be trained in these techniques to ensure optimal outcomes for patients. ONT is generally safe when administered by trained professionals. Most side effects are mild and transient, such as local pain, bruising, or temporary muscle weakness. Serious adverse reactions are rare. Intraarticular and intramuscular injections have a strong safety record, making ONT a reliable option for many chronic pain conditions. Patients should be informed about potential risks and monitored after treatment. ONT is often compared to corticosteroids, anesthetics, and other pain management strategies. While corticosteroids may provide faster pain relief, ONT's effects can last longer and have a lower risk of recurrence. The choice between treatments depends on the patient's condition, previous response to therapy, and risk profile. ONT is especially valuable for patients who have exhausted other options. Despite promising results, research on ONT in chronic musculoskeletal pain is still evolving. Studies often use different doses, injection sites, and outcome measures, making comparisons difficult. More standardized, large-scale trials are needed to establish optimal protocols. Clinicians should stay updated on the latest evidence to provide the best care for their patients. As research continues, ONT may become a more prominent part of pain management protocols. Ongoing studies are exploring optimal dosing, timing, and combinations with other therapies. Personalized treatment plans based on patient characteristics and response to ONT are likely to improve outcomes. The future holds promise for expanding the use of ONT in chronic pain management. Selecting the right patients for ONT therapy is crucial. Candidates are typically those with chronic refractory pain who have not responded to standard treatments. A thorough clinical evaluation helps identify the most appropriate injection sites and dosing. Patient education about expectations, potential benefits, and risks is an important part of the treatment process. Personalized therapy is becoming increasingly important in pain management. By tailoring ONT treatment to individual patient needs, clinicians can maximize benefits and minimize risks. Factors such as pain location, severity, previous treatments, and patient preferences all play a role in designing the best approach. Ongoing research will continue to refine these strategies. Summary: botulinum toxin offers a valuable option for managing chronic musculoskeletal pain, especially in cases where conventional treatments have failed. Its unique mechanism of action, favorable safety profile, and versatility across multiple conditions make it a promising addition to the pain management toolkit. As research advances, Bowenty's role is likely to expand, providing hope for patients with persistent pain. Thank you for joining us on this comprehensive overview of Bowenty in chronic musculoskeletal disorders.